week. And John Prosser is back with us, Vice President and partner of Health Partners Home Care and a spokesperson for the Committee to Protect Auto No Fault. John Kornack is with him, too, president of the Eisenhower Center in Ann Arbor, which I once had the opportunity to visit not that long ago. Seems like a million years ago, but
it does.
This topic we've been talking about now for, what has it been? About 3 to 4 years, 3 years now, that the auto no-fault law in the state of Michigan has been under attack by certain groups who want to modify something that's been working very well, you say, for over 30 years.
That's right. It's been described by insurance companies themselves as the finest model in America. And at the time that this was adopted, Michael, 40 years ago, insurance companies were joyous because they were going to save 33% of every premium dollar that was at that time spent on litigating, about who's at fault and who's going to pay. And our legislature, in their infinite unique wisdom, crafted this beautiful model that turns that paradigm around and says, when people are catastrophically injured and suffer a brain or a spinal cord injury, they're going to get comprehensive resources because that population, just like in every other state in America today, that population is underserved and undercompensated.
No fighting, no fuss, no questions asked. If you get a catastrophic brain injury, you get coverage for life.
That's correct. Funded by Drivers for Drivers with a catastrophic fund in Michigan that we know holds $15 billion. We don't have this year's June 2014 ending report for the prior year. Some people estimate it might be up another billion or two.
Mm-hmm. And just, I know it's impossible because every case is different, but John Kornack, how much would it cost for a year to treat someone with a catastrophic brain injury?
Well, that can be very expensive. If you're talking about right out of the hospital, it can be in the millions of dollars. So if someone's catastrophically injured and they're in a coma, they're inducing that coma, they're keeping him in that coma for 3, 4, 5 weeks, and in a hospital that can run the charge up quite high.
Millions of dollars.
Oh, millions of dollars.
And nobody's got millions of dollars in the bank to pay for it themselves. And
no.
Their insurance companies aren't paying for it either. Then it's from a fund that they themselves paid into, that we all pay into every year in our driving insurance.
Yeah, this year it's $186. They didn't change it this year because of the lawsuit, the transparency lawsuit. So there's too much pressure on that side of the price setting scheme. So now they're moving back over to PIP. But what happened when we have the finest model of insurance in the country, we also have the finest model of care. So that's what came from this. We also have the best network of how people are cared for in the whole nation happens right here in the state of Michigan. So we are a leader in that way as well. And it's because the insurance companies and the no-fault system is so popular and it works so well.
So for $186 a year, that's already rolled into my car insurance bill. I have wall-to-wall lifetime coverage in case of a dreadful accident.
Yep.
Nobody in my family has to worry about it. I wouldn't be capable of even worrying about it at that stage. And so that's a bet, $186.
Oh, yeah, that's the greatest insurance you ever purchased.
That's the most dangerous thing we do is to drive a car, I would think, right?
Well, insurance is risk management. Excuse me. And as such, it was wise of our government, of our legislature in 1972, to insist on this model because it does protect us from that very scary reality. Most people are unfamiliar with the fact that every day in America, 800 people suffer a brain injury in an auto accident. 25 people are paralyzed from an auto accident every single day in America. So the real question is, if insurance is risk management, why doesn't every other state have this superior model? And, the insurance companies know that this is the finest model in America. That's their description. That's their narrative.
But you could flip it around, and the people who want to change it here could say, well, if no one else has it, why do we?
Well, exactly. They have said that, and that's part of our contention in our lawsuit. CPAN and the Brain Injury Association of Michigan filed suit to get all of the rate-making information. You might recall back in 1978, the Shavers decision says that Michigan drivers have a constitutional right to all information about setting rates. This is a corporation created by government operating in secrecy. They're actually competing with Mr. Madoff for who can be the most secret about how we're handling the billions of dollars.
So what the opponents want to do is cap how much can be spent on a victim.
What they want to do is they want to focus on greater profits for themselves. Yes, so you said it the other way. They want to put a noose around people and limit what the benefits would be so that they can enjoy greater profits. For listeners that are interested in this, and our hope is that people will take an interest and go to the CPAN website, cpan.us, and then get educated on this topic and contact your senator and contact your representative and insist on transparency. That's all we're asking for. We're required to pony up the cash. And the absolutely astonishing reality is the appellate court said we, the people that are compelled to buy this in a captive state, do not have standing. We are not entitled to know what they're doing with our information, with our money.
And the average person is going to be told, the average voter, if you will, that you can pay less for your car insurance if this goes by how much?
Well, I mean,
they've said 15% and things of that sort.
15%.
Yeah, so they're using
$180.
Yeah, but remember, the person who's telling us now are our agents, so the people we believe in. That's why we go buy insurance. We like our agent. We've been with them
Protecting
for 20
us,
years.
right?
Yeah, and so now
like a good neighbor.
Like a good neighbor. So we go down there and we say we like you. They hand us a pamphlet that say the reason your rate's going up is because the insurance, healthcare care, the price of healthcare, and it's just putting pressure on that rate. So that's what's occurring, and so they're using our friends, our agents, to help push the message out.
I don't know if I necessarily need to save 15% on $180 and risk not having lifetime coverage if it were to happen to me.
If it happens to somebody that you love, Michael, or yourself, it's the most important topic that day. Nothing's more important.
And forever, probably.
Right.
Well, that's right. And Jay Angoff, the expert for CPAN, just revealed that in his analysis, the insurance companies who manage the MCCA have actually paid less than 15% less than they projected in their claims, which determines the assessment. In other words, the amount you pay is based on their projection of what cost is going to be. And Jay Angoff indicates in recent years it's been as high as a 30% overcharge on that MCCA fee. And for certain in the recent long term, 15% overcharging. But again, the insurance companies in their arrogance said, we don't have to tell you, we're not going to tell you. And if we did tell you, you couldn't understand it.
And it's like a sale. I mean, it's easy to get back 15% you should have never taken in the first place. It's let's mark it up a little bit, and hey, I'll give you 15%. I can guarantee that.
You had Lee Woodruff here, the wife of Bob Woodruff, the ABC news journalist who had a brain injury while covering a story in the Middle East. How was her presentation?
Oh, it was great last night. It's great to hear from folks who've lived through it, that are spokespeople for us, and it that crosses more than just Michigan. That crosses the whole nation. So that's more of a national voice, and we love to hear those things. That's why we come to the conference, because it reminds us why we're here. We get to help those who are most catastrophically injured, and we get to fight for those people. So listening to Lee, it gets you all pumped up, and you're ready to go for the next year.
Bob Woodruff did eventually go back to work, and of course he's a Cranbrook graduate from here in Michigan. CPAN.us, healthpartnersinc.com for more information, and our website. You can hear it all over again at mibigshow.com. Thank you to John Prosser and John Cornack.